Hey, Alpha Nurses and Licensure from alphanursguide.com. This is 20 practice questions. Without delay, let's get started.
A healthcare provider has just inserted nasal packing for a client with epistaxis. The client is taking ramipril for hypertension. What should the nurse instruct the client to do? 1. Use 81 milligrams of aspirin daily for relief of discomfort. 2. Omit the next dose of ramipril. 3. Remove the packing if there is difficulty swallowing. 4. Avoid rigorous aerobic exercise. The correct answer is 4. Avoid rigorous aerobic exercise. Epistaxis, or nosebleed, is a common, sudden emergency. Commonly, no apparent explanation for the bleeding is known. With significant blood loss, systemic symptoms such as vertigo, increased pulse, shortness of breath, decreased blood pressure, and pallor will occur. Because aerobic exercise may increase blood pressure, and increased blood pressure can cause epistaxis, the client with hypertension should avoid it. Aspirin inhibits platelet aggregation, reducing the ability of the blood to clot. The client should continue to take his anti-hypertension medication, ramipril. Posterior nasal packing should be left in place for 1 to 3 days. A nurse is completing the health history for a client who has been taking echinacea for a head cold. The client asks, "Why isn't this helping me feel better?" Which of the following responses by the nurse would be the most accurate? 1. There is limited information as to the effectiveness of herbal products. 2. Antibiotics are the agents needed to treat a head cold. 3. The head cold should be gone within the month. 4. Combining herbal products with prescription antiviral medications is sure to help you. The correct answer is 1. There is limited information as to the effectiveness of herbal products. At this time, there is no strong research evidence to warrant recommendations of herbal products for management of colds. Further study is needed to show evidence of therapeutic effects and indications. Antibiotics are effective against bacteria. The head cold may have a viral cause. An uncomplicated upper respiratory tract infection subsides within 2 to 3 weeks. There may be a drug-drug interaction with herbal products and prescriptions. Which of the following activities should the nurse teach the client to implement after the removal of nasal packing on the second post-operative day? 1. Avoid cleaning the nares until swelling has subsided. 2. Apply water-soluble jelly to lubricate the nares. 3. Keep a nasal drip pad in place to absorb secretions. 4. Use a bulb syringe to gently irrigate nares. The correct answer is 2. Apply water-soluble jelly to lubricate the nares. After removal of nasal packing, the client should be instructed to apply water-soluble jelly to the nares to lubricate the nares and promote comfort. Swelling gradually subsides over several weeks. The client can gently clean the nares as soon as packing is removed. A nasal drip pad is not needed after removal of packing. Irrigation with a bulb syringe may interfere with healing and introduce infection. A nurse is teaching a client about taking antihistamines. Which of the following instructions should the nurse include in the teaching plan? Select all that apply. 1. Operating machinery and driving may be dangerous while taking antihistamines. 2. Continue taking antihistamines even if nasal infection develops. 3. The effect of antihistamines is not felt until a day later. 4. Do not use alcohol with antihistamines. 5. Increase fluid intake to 2,000 milliliters per day. The correct answers are 1. Operating machinery and driving may be dangerous while taking antihistamines. 4. Do not use alcohol with antihistamines. And 5. Increase fluid intake to 2,000 milliliters per day. Antihistamines have an anticholinergic action and a drying effect and reduce nasal, salivary, and lacrimal gland hypersecretion, runny nose, tearing, and itching eyes. An adverse effect is drowsiness, so operating machinery and driving are not recommended. There is also an additive depressant effect when alcohol is combined with antihistamines, so alcohol should be avoided during antihistamine use. The client should ensure adequate fluid intake of at least 8 glasses per day due to the drying effect of the drug. Antihistamines have no antibacterial action. The effect of antihistamines is prompt, not delayed. A client has had surgery for a deviated nasal septum. Which of the following would indicate that bleeding was occurring even if the nasal drip pad remained dry and intact? 1. Nausea. 2. Repeated swallowing. 3. Increased respiratory rate. 4. Increased pain. The correct answer is 2. Repeated swallowing. Because of the dense nasal packing, bleeding may not be apparent through the nasal drip pad. Instead, the blood may run down the throat, causing the client to swallow frequently. The back of the throat, where the blood will be apparent, can be assessed with a flashlight. An accumulation of blood in the stomach can cause nausea and vomiting, but nausea would not be the initial indicator of bleeding. An increased respiratory rate occurs in shock, but is not an early sign of bleeding in a client who has undergone nasal surgery. Increased pain warrants further assessment, but is not an indicator of bleeding. An elderly client had posterior packing inserted to control a severe nosebleed. After insertion of the packing, the client should be closely monitored for which of the following complications? 1. Vertigo. 2. Bell's palsy. 3. Hypoventilation. 4. Loss of gag reflex. The correct answer is 3. Hypoventilation. Posterior packing may alter the respiratory status of the client, especially in elderly clients, causing hypoventilation. Clients should be observed carefully for changes in level of consciousness, respiratory rate, and heart rate and rhythm after the insertion of the packing. Vertigo does not occur as a result of the insertion of posterior packing. Bell's palsy, a disorder of the seventh cranial nerve, is not associated with epistaxis or nasal packing. Loss of gag reflex does not occur as a result of the insertion of posterior packing. A client with allergic rhinitis is instructed on the correct technique for using an intranasal inhaler. Which of the following statements would demonstrate to the nurse that the client understands the instructions? 1. I should limit the use of the inhaler to early morning and bedtime use. 2. It is important to not shake the canister because that can damage the spray device. 3. I should hold one nostril closed while I insert the spray into the other nostril. 4. The inhaler tip is inserted into the nostril and pointed toward the inside nostril wall. The correct answer is 3. I should hold one nostril closed while I insert the spray into the other nostril. When using an intranasal inhaler, it is important to close off one nostril while inhaling the spray into the other nostril to ensure the best inhalation of the spray. Use of the inhaler is not limited to mornings and bedtime. The canister should be shaken immediately before use. The inhaler tip should be inserted into the nostril and pointed toward the outside nostril wall to maximize inhalation of the medication. A client who has undergone outpatient nasal surgery is ready for discharge and has nasal packing in place. Which of the following discharge instructions would be appropriate for the client? 1. Avoid activities that elicit the Valsalva maneuver. 2. Take aspirin to control nasal discomfort. 3. Avoid brushing the teeth until the nasal packing is removed. 4. Apply heat to the nasal area to control swelling. The correct answer is 1. Avoid activities that elicit the Valsalva maneuver. The client should be instructed to avoid any activities that cause Valsalva's maneuver, such as constipation, vigorous coughing, exercise, in order to reduce bleeding and stress on suture lines. The client should not take aspirin because of its antiplatelet properties, which may cause bleeding. Oral hygiene is important to rid the mouth of old dried blood and to enhance the client's appetite. Cool compresses, not heat, should be applied to decrease swelling and control discoloration of the area. Which of the following would be an expected outcome for a client recovering from an upper respiratory tract infection? The client will 1. Maintain a fluid intake of 800 milliliters every 24 hours. 2. Experience chills only once a day. 3. Cough productively without chest discomfort. 4. Experience less nasal obstruction and discharge. The correct answer is 4. Experience less nasal obstruction and discharge. A client recovering from an upper respiratory tract infection should report decreasing or no nasal discharge and obstruction. Daily fluid intake should be increased to more than 1 liter every 24 hours to liquefy secretions. The temperature should be below 100 degrees Fahrenheit or 37.8 degrees Celsius with no chills or diaphoresis. A productive cough with chest pain indicates a pulmonary infection, not an upper respiratory tract infection. Which of the following statements should indicate to the nurse that a client has understood the discharge instructions provided after nasal surgery? 1. I should not shower until my packing is removed. 2. I will take stool softeners and modify my diet to prevent constipation. 3. Coughing every 2 hours is important to prevent respiratory complications. 4. It is important to blow my nose each day to remove the dried secretions. The correct answer is 2. I will take stool softeners and modify my diet to prevent constipation. Constipation can cause straining during defecation, which can induce bleeding. Showering is not contraindicated. The client should take measures to prevent coughing, which can cause bleeding. The client should avoid blowing the nose for 48 hours after the packing is removed. Thereafter, the client should blow the nose gently, using the open mouth technique to minimize bleeding in the surgical area. The nurse teaches the client how to instill nose drops. Which of the following techniques is correct? 1. The client uses sterile technique when handling the dropper. 2. The client blows the nose gently before instilling drops. 3. The client uses a new dropper for each installation. 4. The client sits in a semi-Fowler's position with the head tilted forward after administration of the drops. The correct answer is 2. The client blows the nose gently before instilling drops. The client should blow the nose before instilling nose drops. Instilling nose drops is a clean technique. The dropper should be cleaned after each administration, but it does not need to be changed. The client should assume a position that will allow the medication to reach the desired area. This is usually a supine position. The nurse is planning to give preoperative instructions to a client who will be undergoing rhinoplasty. Which of the following instructions should be included? 1. After surgery, nasal packing will be in place for 7 to 10 days. 2. Normal saline nose drops will need to be administered preoperatively. 3. The results of the surgery will be immediately obvious post-operatively. 4. Aspirin-containing medications should not be taken for 2 weeks before surgery. The correct answer is 4. Aspirin-containing medications should not be taken for 2 weeks before surgery. Aspirin-containing medications should be discontinued for 2 weeks before surgery to decrease the risk of bleeding. Nasal packing is usually removed the day after surgery. Normal saline nose drops are not routinely administered preoperatively. The results of the surgery will not be obvious immediately after surgery because of edema and ecchymosis. The nurse should include which of the following instructions in the teaching plan for a client with chronic sinusitis? 1. Avoid the use of caffeinated beverages. 2. Perform postural drainage every day. 3. Take hot showers twice daily. 4. Report a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius or higher. The correct answer is 3. Take hot showers twice daily. The client with chronic sinusitis should be instructed to take hot showers in the morning and evening to promote drainage of secretions. There is no need to limit caffeine intake. Performing postural drainage will inhibit removal of secretions, not promote it. Clients should elevate the head of the bed to promote drainage. Clients should report all temperatures higher than 100.4 degrees Fahrenheit or 38 degrees Celsius because a temperature that high can indicate infection. Which of the following assessments is a priority immediately after nasal surgery? 1. Assessing the client's pain. 2. Inspecting for periorbital ecchymosis. 3. Assessing respiratory status. 4. Measuring intake and output. The correct answer is 3. Assessing respiratory status. Immediately after nasal surgery, ineffective breathing patterns may develop as a result of the nasal packing and nasal edema. Nasal packing may dislodge, leading to obstruction. Assessing for airway obstruction is a priority. Assessing for pain is important, but it is not as high a priority as assessment of the airways. It is too early to detect ecchymosis. Measuring intake and output is not typically a priority nursing assessment after nasal surgery. A client with allergic rhinitis asks the nurse what to do to decrease the rhinorrhea. Which of the following instructions would be appropriate for the nurse to give the client? 1. Use your nasal decongestant spray regularly to help clear your nasal passages. 2. Ask the doctor for antibiotics. Antibiotics will help decrease the secretion. 3. It is important to increase your activity. A daily brisk walk will help promote drainage. 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. The correct answer is 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. It is important for clients with allergic rhinitis to determine the precipitating factors so that they can be avoided. Keeping a diary can help identify these triggers. Nasal decongestant sprays should not be used regularly because they can cause a rebound effect. Antibiotics are not appropriate for allergic rhinitis because an infection is not present. Increasing activity will not control the client's symptoms. In fact, walking outdoors may increase them if the client is allergic to pollen. After nasal surgery, the client expresses concern about how to decrease facial pain and swelling while recovering at home. Which of the following discharge instructions would be most effective for decreasing pain and edema? 1. Take analgesics every 4 hours around the clock. 2. Use corticosteroid nasal spray as needed to control symptoms. 3. Use a bedside humidifier while sleeping. 4. Apply cold compresses to the area. The correct answer is 4. Apply cold compresses to the area. Applying cold compresses helps to decrease facial swelling and pain from edema. Analgesics may decrease pain, but they do not decrease edema. A corticosteroid nasal spray would not be administered post-operatively because it can impair healing. Use of a bedside humidifier promotes comfort by providing moisture for nasal mucosa, but it does not decrease edema. Guaifenesin 300 mg 4 times a day has been prescribed as an expectorant. The dosage strength of the liquid is 200 mg per 5 milliliter. How many milliliters should the nurse administer for each dose? Blank milliliters. The correct answer is 7.5 milliliters. To solve this problem, you set up the formula as 200 milligrams over 5 milliliters equals to 300 milligrams over x. You cross-multiply 200 times x and 300 times 5. You get 200x equals to 1,500. You divide 200 on both sides, and you get x equals to 7.5 milliliters. This is the amount that the nurse should administer for each dose. A client is being discharged with nasal packing in place. The nurse should instruct the client to 1. Perform frequent mouth care. 2. Use normal saline nose drops daily. 3. Sneeze and cough with mouth closed. 4. Gargle every 4 hours with salt water. The correct answer is 1. Perform frequent mouth care. Frequent mouth care is important to provide comfort and encourage eating. Mouth care promotes moist mucous membranes. Nose drops cannot be used with nasal packing in place. When sneezing and coughing, the client should do so with the mouth open to decrease the chance of dislodging the packing. Gargling should not be attempted with packing in place. Pseudoephedrine has been prescribed as a nasal decongestant. Which of the following is a possible adverse effect of this drug? 1. Constipation. 2. Bradycardia. 3. Diplopia. 4. Restlessness. The correct answer is 4. Restlessness. Adverse effects of pseudoephedrine are experienced primarily in the cardiovascular system and through sympathetic effects on the central nervous system. The most common CNS adverse effects include restlessness, dizziness, tension, anxiety, insomnia, and weakness. Common cardiovascular adverse effects include tachycardia, hypertension, palpitations, and arrhythmias. Constipation and diplopia are not adverse effects of pseudoephedrine. Tachycardia, not bradycardia, is an adverse effect of pseudoephedrine. The nurse is teaching a client how to manage a nosebleed. Which of the following instructions would be appropriate to give the client? 1. Tilt your head backward and pinch your nose. 2. Lie down flat and place an ice compress over the bridge of the nose. 3. Blow your nose gently with your neck flexed. 4. Sit down, lean forward, and pinch the soft portion of your nose. The correct answer is 4. Sit down, lean forward, and pinch the soft portion of your nose. The client should assume a sitting position and lean forward. Firm pressure should be applied to the soft portion of the nose for approximately 10 minutes. Tilting the head backward can cause the client to swallow blood, which can obscure the amount of bleeding and also can lead to nausea. Ice compresses may be applied, but the client should not lie flat. Blowing the nose is to be avoided because it can increase bleeding.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.